Hello, good morning. We've got folks starting to roll in. I see a lot of names here that I recognize. Welcome. Good morning, everyone. We're going to wait just about 2 minutes to let people get logged in before we launch today's brief training. Awesome. So many names out there. It's good to see you. Thank you for carving out some time today to tune in. All right, well, in the essence of time, we're going to go ahead and get started. Welcome to media training. This training is called Why Messaging Matters in Suicide Prevention. Thank you for being here. I'm Shannon Decker. I am the executive director and co-founder of an Idaho and Utah-based nonprofit called the Speedy Foundation. And co-facilitating with me today, I have Lee Flinn from the Idaho Suicide Prevention Hotline.
Good morning, everybody. It's great to see you here. Like Shannon said, my name is Lee Flinn, and I've not met all of you. I just started at the hotline as the director on May 1st of this year.
Awesome. We're so excited to have Lee with us. Today's training is going to be recorded and available for anyone who's not able to attend. We really appreciate you being here. Media is a vital partner in suicide prevention. We need you to be our partner as we work from a private perspective, from a public perspective, and everything in between. We do want to give a special thank you to Utah State Board of Education, Department of Health and Human Services, as the training that we are sharing with you has been modified from their new Live On state campaign and their training materials. Today's topic is suicide, and that can be something that's very alarming or jarring to many of us. Most of us have had some type of an experience with suicide, knowing someone who's attempted suicide, or maybe somebody who's died by suicide. And so if at any time this information becomes too much, please take a break. Please reach out to someone that you're connected with that is a great listening ear, or you're always welcome to reach out to the Suicide Prevention Hotline, 1-800-273-TALK. It's 24/7, it's free, it's anonymous, it's a listening ear for anyone and all. And we're gonna talk more about that in just a little bit. This training fits in with Idaho's suicide prevention plan that was updated in 2018. And one of the goals is to really help portray accurate portrayals of suicide and mental illness in media. And encouraging news organizations to implement policies and practice addressing safe and responsible reporting. I get a lot of outreach from reporters, the content of mental illness, the urgency of the current state of suicide rates in the rural Rocky Mountain West is headline news these days. And I know that Lee gets a lot of reach from reporters for information. And so we're just going to go over some of the really high level pieces. But 45 minutes is definitely not enough to cover the ins and outs of suicide. So if there's something else that's of interest to you, please reach out. There's other trainings that are available. But overall, Idaho's goal is to reduce suicide by 20% by the year 2025. This is a national campaign called Project 2025, and we all have a part to play here. Aside from just goal 4, the impetus of this training, we also have upstream prevention efforts. There are organizations in communities throughout the state who stand up and they put together projects. And one piece that we could continue to integrate into our reporting is, where does that activity fit into the larger framework of suicide prevention? So this would be one place that you could go to kind of enhance the importance of the work that's going on in the upstream prevention piece, as opposed to the downstream postvention. And here we have a quick note from our governor, thanking you for being here today.
Hi, I'm Governor Brad Little. Thank you for the important role each of you play in educating Idahoans on mental health care and suicide prevention. Idaho's suicide rate is among the highest in the nation, and we all play a part in preventing suicide. We must work together to instill hope and connection by supporting our families, friends, and neighbors. I appreciate the Idaho journalists and your efforts to report on suicide in the safest, most accurate, and most helpful ways possible. Your reporting can help support Idaho families and strengthen communities impacted by suicide. We are all in this together, and help is always available. Thank you, and God bless.
And I echo Governor Little's message. As a survivor of loss, losing my cousin Speedy to suicide, as well as several friends and acquaintances, everything from the head of government to a private citizen, we all have a role to play in helping to support each other and prevent suicide. Suicide is a public health problem. Suicide is very complex. There's no all-encompassing explanation for suicide. Everybody's looking for reasons why, and there's no one single reason why. There's no single path to lead someone to become suicidal. There's also no one single path away from suicide once somebody has found that to be possibly a solution to an insolvable problem. There's no single medical cause, treatment, or prevention strategy. And so if we can recognize how complex and robust this public health problem is, we can show hope in so many different ways. We can start to target the ways that people who have been there in the past and they have found a place of recovery, how did they find recovery, and how can others get there? So to truly understand suicide in a very brief and basic way, there is a researcher by the name of Dr. Thomas Joyner, and he's identified some pieces that come together. This is his theory of interpersonal suicidality. The key pieces are thought of belongingness and perceived burdensomeness. When a person feels alone and they feel like a burden, they have this desire for suicide. And a person could live there for their whole life. It's not until the capacity for suicide, they're no longer afraid to die, is built, that they might make a near lethal attempt or might die by suicide. And so we have an older interview with Dr. Joyner and Dr. Phil. We're just gonna watch about a minute of it where he explains this model. Later in the interview, he does talk about suicide rates during global pandemics and times of national crisis. And so it might be a video that you would be interested in watching the full length on. But here's about a minute of it.
Dr. Joyner believes that people considering suicide share three traits in a very common way. And the first one is feeling like a burden on other people, and that their death will be worth more than their life. Talk about that.
That's right. It's the idea, the mental calculation that my death will be worth more than my life. If you truly believe that, you could see how that would facilitate suicidal behavior. And we've shown in multiple studies that it does indeed do that. Crucially, the person is mistaken in that perception, but the trick is that they don't know that they're mistaken in that perception. They believe it to be true, and it spurs suicidal behavior.
And isn't it true that most suicidal situations and dilemmas that push people over the edge are transient? That if they had just stuck it out, they tend to get better?
Absolutely. There's no question about that, and there's also no question, as you've already alluded to, that there are good, effective treatments that work for the conditions that underlie suicidal behavior.
Yeah. Psychologically, therapeutically, pharmacologically, there are so many things that can give people relief.
Absolutely.
The second common trait that Dr. Joyner talks about is a feeling of loneliness or social disconnection.
If you look through the literature, the scientific scientific literature on suicidal behavior, arguably the single most powerful risk factor of all is loneliness, a feeling of alienation from others.
Yeah, so they just don't feel like they fit, belong, so they're just on the outside looking in, so why not just leave?
That's right.
All right, and the third thing is an interesting thing that he talks about called fearlessness. Regarding pain, injury, and death. People considering suicide have learned to overcome these natural fears, and you say that that's more common than cowardice or that sort of thing.
That's right. I think it's a common misunderstanding to think of people who have died by suicide as cowardly or weak. That's just not accurate. And indeed, to do something as fearsome and as daunting as death by suicide, you do require a kind of fearlessness in order to carry through.
Yeah. When we come back, we're going to talk about...
All right, so we're going to stop it right there. But it is a brief interview. It's hard to find Dr. Joyner in a brief setting. He has come to Boise, and so it's possible that maybe you've heard him speak in person. But this clip is interesting as it looks at, again, global pandemics and national crises and suicide rates. So the media up in Canada has coined a term, the echo pandemic. So when we're thinking about COVID-19, back in March, around the world, we had a public health crisis that came in like a tidal wave. And following that tidal wave, there's the economic crisis. And what we have seen is that there's a third wave, the mental health crisis, or this echo pandemic. Things of anxiety, depression rates increasing, more experiences with post-traumatic stress disorder, more substance misuse, alcohol misuse. We know that domestic violence rates, child abuse rates have risen, and that there is an increased risk in suicide. These are things that we need to be aware of, but we also need to go back to the data and say what's happening right now. We have a lot of room for prevention efforts, but are we in the middle of a crisis, or is this something that we can anticipate is coming and start to prepare for? Looking at Idaho's rates, this was a report that was run on October 2nd of this year. This comes from the Idaho Violent Death Reporting System. And if at any time you are interested in learning more about that, it is housed at the Department of Health and Welfare. And your go-to guy is Chris Wilson. His contact information is down there at the bottom. He has published the 2020 rates. They are not finalized. These are preliminary data pieces. But when we look at these rates, 2020 is the red line. On October 2nd, we were looking at 291 deaths in the state of Idaho. 291 deaths is a lot. One death is a lot. That's 291 people, citizens of the state of Idaho, people who had families. They might have had jobs. They might have even had pets. And they're mourned, they're lost. They leave a big wake of survivors. But when we're looking at these numbers in comparison to some of the headline news that we're seeing across the country, you know, our suicide rate's spiking. Right now, it doesn't appear that way. Idaho has really high rates of suicide. Our rates are much too high, and they have been for years. So there is urgency. But right now, we're not any higher than we've been in the past 3 years. So that's a silver lining. That's a piece of hope in this day and age in what we've got going on. And I'm going to turn things over to Lee, because Lee has a pulse on what's going on at the hotline, who's reaching out for help, and what's taking place there.
So a little update from the hotline. First of all, we always like to emphasize that we provide support, crisis intervention and suicide prevention support to help seekers or callers anywhere within our state. A person does not have to be suicidal to call. So we're just now looking at the data that we've collected in the third quarter, just over the summer. And one of the things we're noticing is that our call volume for this time period is up about 12% in comparison to the same time in 2019. Now that's, you know, it's always hard to tell what that means. It could mean that more people are hearing about the hotline. It could mean that there are more people feeling in crisis. And you know, as I said, a person doesn't have to be suicidal to call, but again, in the same time period, 22% of the people contacting us reported feelings of feeling suicidal rather. And that is exactly the same as it was for the same time period in 2019. You know, as Shannon mentioned, and as all of you know, Idaho already had a high rate of suicide even before the pandemic. And that's, you know, and so that's something that we struggle with. You know, 22% of callers feeling suicidal in the third quarter. That's 834 people that contacted us reported feeling suicidal. During this time, we are noticing an increase in reported anxiety from the people who are contacting us. And, you know, as in 2019 and all the years before that, other reasons that people call the Idaho Suicide Prevention Hotline are, in addition to suicidal thoughts, there's also the stress brought with economic struggles. When someone loses a partner or a spouse, people who are struggling with addiction and other variety of personal conflicts. One thing I'd like to point out is that suicide and crisis are lifespan issues. So to date, since the hotline's been in existence since 2012, our youngest caller was 8 years old, and our oldest caller was 93 years old. And we find that a lot of people are surprised by that. It's, again, a lifespan issue. So we're going to show you some, just very quickly, we're going to roll through some images, and I want you to just notice how you feel. All right, so if you would, drop a quick word in the chat and just make note of how those images made you feel. And then we're going to pivot and show you some different images.
Alone. Thank you. Sad. Heartbroken. All right.
All right. What came up for you that time? If you do the same, drop a word or two into the chat on how that made you feel.
Hopeful, 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 hopeful.
There's definitely a theme there, it seems. So Dr. Christine Moutier from the American Foundation for Suicide Prevention, she explains, we believe strongly that the issue of suicide is really important to raise the volume on. So it's not that portrayals are all bad, it's the way that it's done and that it needs to be, with a prevention message and a message of hope, something that can inspire others to work through life struggles, whether they're way upstream from actually being in crisis or even when it's at the moment of suicidal crisis. And I think that those images certainly drove that point home. So why messaging matters? That's really the whole reason for coming together today. So when we say what we say matters, that pertains to us as individuals, and it certainly is relevant for you as reporters and journalists. So what we say, what you say, it can hurt and it can increase a person's risk for suicide, or it can help by promoting resiliency in communities. Many studies demonstrate that certain types of news coverage actually increase the likelihood of suicide. And that you know, changes with the type of coverage, the amount, the duration, etc. So the take-home message from this is that risk absolutely increases when a news story, when a reporting describes or shows the suicide method, when the story uses graphic headlines or over-dramatizes the story, and when the coverage is extensive or is repeated in the media. So there are a couple quick historical references that we want to point to, and these are both examples from the 1700s. So the first one is called the Werther effect. And that's a term used in social sciences and medicine, and it's used as a synonym for media-induced copycat suicidal behavior. It's drawn from the Goethe novel called The Sorrows of Young Werther. And in that story, the hero takes his own life. At the time that this was published, it was widely read in Europe. And what was noticed at the time is that it is thought to have precipitated a wave of suicides in Germany and throughout Europe. And it particularly affected young men who dressed as Werther, is depicted in the story. And they killed themselves actually using the same method that Werther used, and often carried a copy of the book. So contrast that with what is called the Papageno effect. And that is a term derived from the protagonist in Mozart's opera, The Magic Flute. So it's the opposite of the Werther effect. In the Papageno effect, in The Magic Flute, the main character fears that he's lost his love, and he prepares to take his own life. So what's different in this story is that friends remind him of his reasons to live, and he, instead of taking his own life, he draws on his own coping skills and the community around him. So interesting historical references, again, both from the 1700s. Another powerful example that I'm sure all of us remember was in August of 2014, Robin Williams died from suicide. At that time, death from suicide, or rather, there was a 50% increase in calls to the National Suicide Prevention Hotline, and that was in the week following Robin Williams' death. After that, there was a long-lasting effect. For 5 months after his death, the number of suicides in the United States increased by 10%, and it was particularly noticeable among men aged 30 to 44. Their suicide deaths increased by 13%, and it was also noted that many of these men used the same method of suicide that Robin Williams did. So again, a very powerful example. As journalists, you have the power to report accurately and to give people the courage to live. So messages that help, and that I know that Shannon and I appreciate you all using these messages, you know, really articulating that suicide is preventable and that we all can help prevent suicide. Raising awareness of the warning signs that help keep a person safe, messaging that talks about the importance of restricting means when a person is feeling suicidal. That could mean removing pills, removing a firearm temporarily. And it kind of goes contrary to our culture in the US, but it's incredibly important to ask a person directly if they are feeling suicidal. A lot of people, kind of shrink away from that because they think it's going to make things worse, and it actually doesn't. It provides an opening for a very critical conversation. And sharing experiences of those who have overcome a suicidal crisis, and overall, really sharing messages of hope. So as Shannon mentioned earlier, suicide has multiple causes. It's very complicated, and there's not just one thing that we can point to. So again, messaging that helps in the media are neutral headlines, and also making it clear that suicide is not a natural or logical outcome of adversity. And this is probably particularly important during a pandemic. Again, suicide is not a natural or logical outcome of adversity. We probably all know people who have struggled greatly with loss or mental illness of some sort that never felt suicidal. And so again, it's hard to tell. Another thing that is very important in reporting is that trends are described in a neutral way and without alarm. So rather than describing skyrocketing suicides, to maybe describe suicides as increasing. So media in Idaho are really good about always including phone numbers. So these are the numbers. The 208 number is for the Idaho Suicide Prevention Hotline, And people can also reach the Idaho Suicide Prevention Hotline through the 800 number. Both are good. And then just a quick mention that in the summer of 2022, a national 3-digit code will be implemented as a mental crisis emergency line similar to 911, and that number will be 988. So that'll make things a lot easier when that number is actually implemented.
All right, and you know what? I'm gonna switch back and just encourage you, if this phone number, these 2 phone numbers are not already programmed into your phone, please add them as a contact, because it might not be for you and it might not be for right now, but someday that number could help save a life. All right, so there are guidelines. There are other organizations out there who have put together best practices. And as we wrap up this training, I'm gonna show you where a lot of these are located, but these are the national recommendations for depicting suicide. If at any point you are needing to report on a story and you're not sure exactly how to best frame it, this would be a document to refer back to. There's another document called Recommendations for Reporting on Suicide, and this has the do's and don'ts. How do we reframe a headline? How do we reframe and avoid offering misleading information? How do we instead offer hope? Things like, instead of big sensationalized headlines and prominent placements, an example being Kurt Cobain's death, using a shotgun to commit suicide, instead, try to find ways to not sensationalize it. Kurt Cobain dead at 27. Kurt Cobain was a prominent person in the musical industry. He had a big following. And so following his death, it was another Robin Williams type situation where it led to a contagion. So I'm sure that if you're in the media, you've seen these before. You might have them printed at your cubicle. I've been through the newsroom and I've seen them displayed, so I appreciate that. But language matters. There are words that we can use to help destigmatize. We try to avoid things like committed, completed, and successful. Instead, we can say things like died by suicide, died as a result of a self-inflicted injury, or took his or her own life. And the founder of the QPR Institute has put together a maze to take you through the best practices of language to use and the historical context of the language. So if you're interested in that type of information, we have it linked at our QPR page, speedyfoundation.org/QPR. So it's really helpful to understand the historical context of that language and how by just changing some simple words, we can destigmatize a very complex topic, a very emotionally charged topic. And power of language. There are also media do's and don'ts, social media do's and don'ts, blogging do's and don'ts. When it comes to suicide in social media, we need to remember to use content warnings because people are going through social media and they're going from advertisements to family updates to all of a sudden maybe a very heavy topic. We want to make sure that we're not using images of a person engaging in suicide. We want to use images where they're engaging in life. We don't speculate a person's last thoughts or reasons for taking their life. We don't want to publish suicide notes or republish their last social media posts. Memorializing a person can be triggering, and so we want to really weigh whether it is bringing hope to others. We really need to consider grieving family and friends. I know that from my experience in losing Speedy, it was reported on the news before the coroner had come to notify the family. And thankfully, there was a breakdown in the chain of command behind the scenes with law enforcement, and they notified the family. But there can be devastating effects on what gets presented publicly while the family is still processing a very sudden and unexpected loss. We really want to highlight protective factors. Protective factors are the thing that counterbalance with risk factors. And right now with COVID-19, that's an additional risk factor that's heavily weighing on our society. And so if you are not familiar with protective factors and risk factors, I really recommend you reaching out to take an additional training of some sort. The Idaho Resilience Project has a lot of people who are out in communities offering trainings on that upstream prevention piece. And another piece that we can use is really using folks with lived experience who have overcome those suicidal thoughts and can explain what helped them find that place of recovery. Those would be some really great pieces to highlight in social media and across media platforms. Additional concerns, non-journalists don't verify their sources. They just repost. And so that's the power of professional journalists. And we do appreciate the work that you do. We know that online content lives forever. Even if you take it down, it's out there. I don't know if you've seen the metaphor of a tube of toothpaste. Parents or teachers will ask somebody a young person to squeeze out all the toothpaste from the tube. And then they say, okay, now put it back in there. There's no way to put the toothpaste back into the tube. You can try all that you want, but it's already out. That's the same with what we put out into the media, into the web. There are also pro-suicide websites and pro-suicide chat rooms out there that we really need to be careful of and making sure that we're not promoting. So we have a quote here from Dr. John Draper. He is the director of the National Suicide Prevention Lifeline. And we know that we cannot not report on suicide, but when anyone dies, the focus should really be on the cause of death, should not be on the cause of death so much as what they meant to the living and what they meant to people around them, because their story of their life is so much more important than the story of their death. And so again, we're gonna have a whole bunch of different national resources for you, and I will just wrap them up on the Speedy Foundation so you have one spot to click, or you're welcome to take a screenshot of this slide. We're finishing a little bit early, leaving time for questions and answers. On this page, we did a training last year at a news outlet. It was more of just a roundtable Q&A. What are some of the best practices? And one thing that came up was warning signs, risk factors. How do you know? And that's not what today's training was. Today's training was on safe messaging. So if you're interested in the warning signs and how to ask the question directly, that's called a gatekeeper training. And there's a lot of options out there. I'm happy to talk to you about what the option is that might fit your need the best. Right now, the Speedy Foundation and the Idaho Department of Education are both offering free online on-demand QPR trainings. That stands for Question, Persuade, Refer. It's a gatekeeper, but there's a lot of other options that are out there. And last year at that training, one of the questions from some newsroom, I think it was a production crew, they said, what kind of B-roll footage should we be showing if you don't want to have these hopeless despair imagery? And so I reached out to this national listserv, and the state of Utah has created a little database of images to pick through. So we will add a link to that on the safe messaging page so that if you are looking for an image to go along with your story, or if you need to go out and shoot some B-roll footage, it'll give you some ideas of ways to highlight the hope in life. So in the Q&A section of a Zoom call, or even in the chat section, feel free to start adding any questions that you have. Know that Lee is always available. Her email is listed, as is mine. And then again, we will list the trainings, the resources, and this recording at the Speedy Foundation /safe messaging. Are there any questions or comments?
Comments are also good. Is there anything that we can provide to support the work that you all do?
All right. Well, I'm going to drop the PDFs of the documents that were discussed earlier, and again, they will be available. I think I'm going to drop them in here for you. Let's try that again. Just to have as a quick reference. It looks like it's not taking them. Okay, well, I'm not able to drop the PDFs in today, but I will follow up with an email of those. As you close out of today's webinar, there will be a quick survey just to give us some feedback on how today went. But that's what we have for you, a brief survey or a brief training on messaging. And again, we're happy to stay on to answer any questions, or you can reach out to us individually.
Thank you so much, everybody. It was great that you were here today. We appreciate visiting with you and working with you.
Absolutely.